mynews.studio.
Picture this: a shipment of the world's first 5-in-1 meningitis vaccine landing at a dusty airstrip in northern Nigeria. The big question is, can science and local tradition actually work together to stop these deadly outbreaks?
Today's date is November 14th, 2025. Across Africa's meningitis belt, there's a new vaccine being introduced. This one targets 5 major strains of the bacteria responsible for repeated, deadly outbreaks. Why is this such a significant development?
For years, the meningitis belt, which runs from Senegal all the way to Ethiopia, has faced regular severe epidemics. This new vaccine, Men5CV, is the first to cover all the main strains of Neisseria meningitis found in the region. So, if it works as planned, it could stop tens of thousands of deaths and cases of disability every year.
How did this vaccine actually come together? It can't be just a scientific breakthrough, right?
You're right. It's much broader than just science. This was a global effort. Organizations like WHO, Gavi, PATH, and national health ministries teamed up with vaccine makers. They shared resources, combined their data, and made sure the vaccine would be both affordable and widely available. Logistics, funding, cross-border cooperation, all of that mattered just as much as the lab work.
But getting a new vaccine out there isn't just about having enough doses. How are local communities actually getting involved?
That's a key part. Countries are involving community leaders, like the Emir of Gumel in Nigeria, to help launch vaccination campaigns. Health workers are specially trained to answer questions and concerns. Outreach happens in the local languages, and even the timing takes things like religious fasting into account. All of that helps build trust and tackle misinformation.
So it's not just a top-down rollout, real community involvement. Does that translate to better vaccination rates?
That's the intention. By working with trusted local figures and tailoring the messages, uptake should improve. It's also about making vaccines accessible, bringing them closer to people's homes, not expecting families to travel long distances.
What about safety? How do they make sure the vaccine is actually safe and effective?
There's strong monitoring in place. Surveillance networks track meningitis cases and vaccination coverage. Health workers use both paper and digital tools, depending on what's available locally, to report any side effects. The data goes to WHO and other partners, who review it regularly to spot any problems early and to see if disease rates are falling.
Could this model, international collaboration, strong community engagement, work for other diseases too?
It's already starting to. The Men5CV project has shown that long-term partnerships, flexible funding, and community trust are critical. These lessons are feeding into vaccine programs for malaria, Ebola, and more. In a sense, it's a template. To collaborate widely, engage locally, and pay close attention to logistics.
What's the biggest challenge now? Is it money, politics, infrastructure, or something else?
Honestly, it's all of those. Delivering vaccines means dealing with tricky logistics, like cold storage and rough roads. Funding can't just be a one-time thing. It needs to last. Political stability is important too. But what we're seeing with Men5CV is that with the right partnerships, these challenges can be managed.
Why should someone outside Africa pay attention to this?
Stopping epidemics where they start helps protect everyone. Diseases don't respect borders. Plus, the approach developed here could be adapted for other global health threats. It's about health security for all, and it shows what's possible when countries work together.
So what's next? Is the rollout happening everywhere, or are there still obstacles to tackle?
The rollout is underway, starting with countries at highest risk. Some areas move faster than others, depending on logistics and government priorities. But there's clear momentum, and the early results look encouraging.
Let's recap. Africa's meningitis belt now has a 5-in-1 vaccine built through international teamwork with strong community involvement and monitoring. This approach could change how we tackle other diseases too.
That sums it up. It's a story of science meeting tradition, logistics, and global determination. Thanks for listening. This episode was powered by mynews.studio. Try it out for free.